Welcome, everyone, to the National Museum of American History's Colloquium Series, Pandemic Perspectives. I'm Lexi Lord, and I'm the chair and curator of our Division of Medicine and Science here at the National Museum of American History. Beginning in February of last year, our museum began thinking about how to best document the COVID-19 pandemic. And we've been working since then with medical practitioners, caregivers, teachers, and others to collect objects that reflect the story of COVID-19 and its impact on America. To ensure that our collection fully represents this extraordinary story and that it reflects multiple perspectives, we really need your help. And if I may ask Megan, if you could flip to the next slide. We'd love to have you join us on our Stories of 2020 project, and we also hope as well to hear from you with your ideas about what to collect. You can always email us at covid19@si.edu. And in thinking about today's pandemic, we've also been thinking about the objects that are already in our collections. In fact, when we looked at our existing collections, we discovered many objects that can provide us with insight into what we're experiencing today. So beginning in September, we started this series, which is called Pandemic Perspectives, and it looks at our collections in light of current events. And you can check out past talks and register for upcoming talks. We only have one more coming, but you can register for that on our website. And you can also listen to the recordings of our previous Pandemic Perspectives panels. We hope you'll join us for that last Pandemic Perspectives, which will be on March 23rd. And we'll be looking a lot at the collecting that we at the National Museum of American History have been thinking about over the past year. And in developing and presenting this series, we want to thank our partners, the Smithsonian Affiliates. Smithsonian Affiliates develops long-term partnerships with museums and educational organizations across the country to make our collections and resources widely available. Our network of more than 200 affiliate organizations collaborates with the Smithsonian's and with each other to create experiences that educate and inspire. Before we begin today, I just want to say that I very much hope that this will be a discussion. And so we hope you'll join us in asking questions of our speakers. And to ask a question, you should just go to the Q&A bar at the bottom of the screen and type in your question. And now I'm really pleased to introduce our panel of distinguished scholars. Peter Leopold is a curator in the Division of Work and Industry at the Smithsonian Institution's National Museum of American History. His curatorial responsibilities include agriculture, manufacturing, mining, petroleum, and rail. At the Smithsonian since 1985, he has co-curated numerous exhibitions, including American Enterprise, Bittersweet Harvest, the Bracero Program, 1942 to 1964, Treasures of American History, Barriers to Bridges, Asian American Immigration After Exclusion, America on the Move, Between a Rock and a Hard Place, A History of American Sweatshops, 1820 to the Present, Images of Steel, 1860 to 1994, and Who's in Charge? Workers and Managers in the United States. Molly Kinder is a David M. Rubenstein Fellow at the Brookings Institute's Metropolitan Policy Program here in Washington, D.C. Her research focuses on the present and future of work for low-wage workers, women, and workers of color. Kinder's research brings the voices and experiences of workers during the COVID-19 frontline to inform policy recommendations to better compensate, protect, and support essential workers. She has 20 years of experience in research, policy, innovation, and impact investing. Previously, she was a professor of practice at Georgetown University, a director of research with New America's Workers and Technology Program, and she served in the Obama administration. Jacob Remus is a clinical associate professor in New York University's Gallatin School of Individualized Study, where he also directs the Initiative for Critical Disaster Studies. Trained as a labor and working class historian of North America, he studies and teaches about disasters, cities, workers, and immigrations, and the way that these things interconnect. He's the author of Disaster Citizenship, Survivors, Solidarity, and Power in the Progressive Era from the University of Illinois Press in 2016. And with Andy Horowitz, he's the editor of Critical Disaster Studies from the University of Pennsylvania Press, forthcoming this year. Remus received his PhD from Duke University, and in addition to NYU, he has taught at Duke, Harvard, Columbia, SUNY Empire State College, and Meiji University. So welcome, and welcome to all of our guests. We're really pleased to have this discussion today. So essential work is always present, but it's usually invisible. And during disasters, obviously, the invisible becomes much more apparent and much more important. What we're going to talk about today will be to explore essentiality in terms of making life work, but also how society pays for essential work and how we assign prestige or how we don't assign prestige to essentiality. And in the background of our discussion today will be the question of who really gets the profits of capitalisms. And we're going to start by thinking about this big question of what do we think is essential work during normal times, during a war, during an epidemic. And I think what I would like to do is actually ask you, Jacob, if you could just talk a little bit about how disasters sometimes shift our ideas about what is essential work.
Yeah, so thanks. And thanks for having me. It's a real pleasure to be on this panel, to be part of the, to be on something for a museum that I grew up going to. That when you were reading Peter's discussion list of exhibits, there were many that I went to. But to answer your question, I think one of the things that disasters do is that they change the way people see the world around them by really throwing into relief what is and is not necessary for survival. So if we think of kind of a hurricane as a classical disaster, if the roof of your house flies off, it becomes very obvious how important shelter is. If you can't get food because the roads are blocked or because a wildfire has destroyed fields, you can really see how important food and agricultural workers are. And so I think one of the things that disaster does is show classes of workers that are really essential. The other thing that sometimes disasters do is by taking people out of the workforce because they are often because they are injured or because they're dead, we can see that what they have been doing is work all along. And so for one of the disasters that I've written about, the Halifax explosion in 1917, after there were mass injuries of people and of women who had been doing things that were not seen as work, cooking and cleaning for their families, once they were no longer able to cook and clean because they were injured or because they were dead, it became really obvious both to their families and to the state that what they were doing was essential work, because once they weren't doing it, it became clear that somebody had to do it. And so you actually got policy innovation. We got in that story, you got essentially kind of a small pension akin to workers' comp that injured women got because it became clear just how important their work was. So I think in lots of ways, disaster can make visible that which was visible all along, but cast new light on it or make it really unavoidable.
So I think what you're saying too, and I think this is an issue that we're going to play with throughout this discussion, is that in some ways too, essential work, our understanding of what it is, can sometimes shift, or even our awareness maybe of what it is shifts over time, which obviously is something for us as historians to be thinking about. What I want us to talk about today, and the big questions that I think we should be thinking about, are this question of what is essential work, who is an essential worker, and how do we evaluate or value that essential work. And so I think what maybe we should start is I'm going to ask our audience if we could do a quick poll. And I know this is going to be a really tricky question, but if you were a governor and you were running for re-election, which essential workers would you allow to be vaccinated first? And here, we're going to make this really tricky for you. And we're going to say choose only one, because I think we can almost argue, as we'll see, that almost anyone can fit in this category. So if y'all could take just a minute or so to respond to that. Oh, and it is really hard. Great. So are we getting some answers for what we're looking at? Okay. All right.
Looks like the National Hockey League is not doing well.
Yeah. And Nora, theme parks. In some ways, we should ask these questions. I think we'll come back to this question because in some ways, we might argue that mental health is also important, but it's interesting for me, especially as a historian of medicine, to see hospital maintenance staff so high, but also obviously grocery clerk and teacher as well. So let's start by asking this question of how essential work has been defined or how we think about it. So if I could ask Megan for you to go to the next slide. To look at sort of the issue about caring for the sick and the elderly. We raised that issue of hospital maintenance worker. Hospitals are staffed by a huge number of people. So when we're talking about people in hospitals or a hospital worker, who are we talking about as an essential worker?
Maybe if Megan could take the poll away, because it's covering up part of our choices there.
All right. You should be able to see it. So I'm wondering, Molly and Jacob and Peter, how, when we think about, people working and caring for the sick or the elderly, I mean, who are we talking about as traditionally seen as essential workers, or what is this essential work? What is the kind of work that we're talking about in a hospital?
I'd be happy to jump in. I think in this COVID-19 pandemic, we've heard a huge amount of public appreciation and recognition of hospital and health workers in particular. And often the first profession that comes to mind when you think of essential workers in this pandemic are nurses and doctors. They're the sort of face of who we instinctively immediately recognize as an essential worker. But the truth is, and there's no question that nurses and doctors are out on the front line. We could not carry on keeping this country safe and even caring for COVID-19 patients without their work. But they're just one of many essential workers in the healthcare space. And in fact, I did a report for the Brookings Institute looking at who are the healthcare workers who are so often overlooked. They're essential, but they're undervalued and they're underpaid. And actually, there are a huge number of workers. I calculated about 7 million low-wage health workers who are essential, who are not nurses and doctors. So they're in direct care roles. So think of a certified nursing assistant or the staff at a nursing home or home health aides, for instance, people in roles where they're directly caring for patients. We have a picture here that I took of a hospital housekeeper named Andrea, for instance. There are more people, more essential workers in jobs like janitors and housekeepers than there are doctors and physicians in all of healthcare. So there's a huge number of people in environmental services, so meaning cleaning, maintenance, housekeeping, dietary, security guards, for instance, in hospitals and healthcare, as well as a whole range of patient-oriented workers that are not doctors and nurses. So phlebotomists, there are people who are really working very closely, patient tech type roles, where they're workers who don't earn nearly as much as a nurse or a doctor, but they're directly engaging with patients even before the nurse and doctor come in. Something that I've been interviewing a lot of these workers throughout the pandemic. And, one of the headlines is a lot of these workers know they're essential, they feel that they're essential, but they feel like there's a gap between the public recognition of nurses and doctors and for their role. So I've even stress tests with questions like, do you get any food delivered or thank yous? Is the public coming forward in some way? Because I don't know if any of you have received this. I've received emails asking for donations to have pizza delivered to nurses and doctors or healthcare workers getting this appreciation. And I ask, who does that include? Does that include the housekeeper? Does that include the maintenance crew? And the workers I interviewed in those positions often feel like they're not getting that same public recognition for their role. And I had so many quotes saying, we respect nurses and doctors, but we couldn't be a hospital without all of these other workers or care, whether or not in a hospital setting or in some kind of care setting. So actually, I think that when we should be thinking about essential workforce in healthcare, we should be thinking very expansively with a really wide range of roles and skills and backgrounds, and certainly pay and prestige baked into that.
And I would add to that. Not only are there these within these hospital and healthcare settings, are there large proportions, as Molly says, in fact, the majority of people are not the kind of high prestige doctor and nurses. But when we think about American cities right now, increasingly, these are the major employers and these are the major industries that dominate American cities. So but for example, in the Bronx, fully a quarter of people who live in the Bronx work in healthcare and social assistance. 19% of people in Philadelphia County. And this went, so when we are, and yet these are workers who, as Molly says, are often ignored, invisible, low wage. When we think about the dangers that they face, right? So when we think about occupational safety and health, overwhelmingly we think about construction workers, or we can think about miners, or we thanks to a lot of propaganda in the popular media, we think about police officers. But in fact, really dangerous occupations are a lot of these healthcare, these low-wage healthcare aid jobs, in which people really have to fight for basic occupational safety and health protection. There's a new article out about the 20-year fight to get from the early 80s to 2000 to get protection for health workers from accidental needle sticks and therefore from hepatitis and HIV. And so those are jobs that we don't often think of at all, or we don't think of as dangerous, but are in fact very dangerous and really central to our cities and to our economy.
Jacob, can I add to reflect on this particular slide? Just a little anecdote about the picture of this woman named Andrea, just to go to your really valid point about how there's a connection between the low pay, low prestige jobs and health and care and access to safety. I heard this over and over, that whether it's the housekeepers or the dietary, the cooks in the nursing homes, people who are not in practitioner roles of directly engaging with patients at the higher income scale really have struggled to get basic PPE from their employer. And that story that broke my heart, and Andrea told us and gave us permission to share this story through the Brookings platform. She cleans rooms in an operating room, and she heard that there was a patient who'd had COVID-19. So she approached her supervisor and said, "Can I be fitted for an N95 mask?" And her supervisor said, "No, those are for special people," meaning you're not special. And because she's in a union, she was able to escalate that and report that supervisor. But this is something I heard over and over from these lower wage essential positions, that they were not immediately prioritized for protective equipment, and they were deprioritized compared to clinical staff.
So in some ways,
that prestige point is certainly really important, and that the person that designs or uses the heart-lung machine is not thought of in the same way that the person that carries and empties the bedpan. But one of the interesting things that I see going on in disasters is a degree of mobility. At least historically, there's been some job mobility. If you look at the bottom left-hand slide, you see nurses loading hopefully a patient that's still alive but maybe deceased into an ambulance. And one of the interesting things about the 1918 pandemic was that a number of schools were actually closed, and it was expected that the teachers would move from closed schools into the Red Cross and act as nurses. If you look at certainly during World Wars, people move from one occupation to another. So essentiality creates opportunity for movement within different types of jobs.
And what we're looking at really is essential work is situated in a place, but there's lots of levels within that place. Everyone's thought of the hospital, but we're not really thinking of the many different professions within that. I'm wondering if we could move and look at sort of other areas where we've been talking about essential work. So the question of food and what is the essential work here?
Well, it's interesting. In this middle slide, you'll see a bracero worker, 1956. This is we don't have a pandemic in 1956, although I guess polio was a problem. But there was concern about having enough workers to pick crops in fields, that there was not enough people power. And so the US created a program that allowed Mexican nationals to come and work in fields. So there was a feeling of shortage of workers, that the disaster was that we didn't have enough people power. And so it was an opportunity for both exploitation and opportunity to get a start. So it was sort of an odd situation in terms of whether it was good or bad, bittersweet.
So I'm curious, I mean, we actually don't have really, here we have one place with a tavern or one restaurant. I mean, is this being defined as essential work, restaurant work? It was interesting because in the poll, as you saw, that was our third top rated response, but it was still very, very low compared to the other responses. So I'm curious what you all would say in terms of restaurant work.
I think it probably comes down, at least contemporary. I'd be really curious to hear from Jacob, because he'll bring a historical perspective and whether that's shifted. When I think contemporary, when I think of this particular pandemic, oftentimes we look to the federal government's guidance of what the Department of Homeland Security has deemed essential industries. That has given us one definition in society of who is an essential worker. And according to the Department of Homeland Security, typically a lot of the workers you see on the slide would be considered essential. The exception is probably the restaurant worker. When the Department of Homeland Security has defined the industries that they consider essential to the operations and services of the country, it's actually a very wide definition and encompasses everything from first responders and garbage collectors to all sorts of hospital and health workers, to utilities and water management, for instance, even some financial services and software developers. But a really large area that is not included in that definition is restaurants, leisure, hospitality, where actually you're seeing huge amounts of layoffs. That's really where we're seeing most of the unemployment. And that is because when there are shutdowns related to public health, when the pandemic gets bad and non-essential businesses are closed, that's why you're seeing so many restaurants closed. It's because they haven't been deemed as essential. That doesn't mean that there aren't individuals even listening into this program who don't think getting their food prepared is essential. It just, according to that particular definition, food production, food selling, grocery, domestic farm workers, meat packing plants, grocery stores, all of that is considered essential. But a nice restaurant in your neighborhood is not necessarily deemed essential.
we actually have a question, and I think it's something that we're probably going to get to it a little bit, but I do want to raise it here. We have a question about the correlation between race and prioritization or status of work. And I'm wondering if you all could speak to that. And also who does the research into this kind of question about race and status of work?
So one of the things that I talk a lot about with my students is this question of status and skill, and how very often what skilled work means is work that men do and work that white people do, and that in fact there's no such thing as an unskilled job, and that so I'm looking at the slide in front of us. The Walmart store associate, which we might think of as kind of a low skilled or lower skilled job, in fact requires a lot of on the job learning about how to do it most efficiently, how to do it most safely, how to do it in a way, how to navigate different interactions and different aspects of the job. And yet, because it is work that is gendered and raced, it's often imagined to be unskilled. And so when we think about which work is essential and hyper visible, it tends to be work that is done largely by white people. And so I think we see this, for instance, in the 1A prioritization of people who got vaccines. The first priority of people getting vaccines were as patient-facing healthcare workers were in fact disproportionately white. And the people who are essential but excluded from that list, in many states still excluded even from 1B, grocery store clerks, delivery workers, lower status hospital workers are more likely to be people of color and are more likely to be women.
Yeah, I would second that. And first of all, I just the question I think is a really powerful and pertinent one. It's also asking us to reflect on our own, in some ways, lack of diversity on the panel and who speaks to these issues of the worth of workers, when so much of the worst sacrifices of this pandemic, what society is asking the most of, are often for workers who have the least. They have the least pay, they have the least benefits, they have the least prestige, and we're asking the most sacrifice for them. And disproportionately, they are workers of color. More even than gender, we found in our data when we looked at who are the essential workers who are facing the greatest risk for the lowest wages. Race and ethnicity was a more prominent variable, characteristic than even gender. But I think it's not an accident that these three pictures show women who are women of color, because when I wrote this report, Essential but Undervalued, looking at this overlooked, low paid health workforce, a lot of these positions, Yvette is this absolutely fabulous home health aide in Philadelphia who I've interviewed throughout the pandemic. Home health aides are a perfect example of a position where it's predominantly something like 80% plus women, and it's disproportionately women of color, but also immigrant women as well. And it's often because these occupations are disproportionately female and disproportionately Black and brown that I think they're underinvested in, that they don't get the same pay and benefits. And there's a lot of research behind this. So my hope in all of this, and same with retail, a good example, cashiers are predominantly women, 60% women, and they're disproportionately workers of color. Walmart, for instance, and Amazon, which are the two largest private employers in the country, their workforce is disproportionately Black and disproportionately brown. So I think this is a big question of, can this pandemic open our eyes to understand the ways that race and gender and pay all come together in these roles, that now there's much greater appreciation for how enormously valuable they are. I mean, society could not function without these workers doing these roles. They just aren't paid enough. They're not protected enough. They're not getting the benefits or the respect that they deserve. And there is this question, well, will this pandemic open our eyes and actually shift policy and practice so that that changes?
So we've been talking a lot about gender, and we just had a question which is interesting because it's a question about transportation workers, bus drivers, tax drivers, train engineers, long haul truckers, and whether their work is also essential work. And that work, maybe I'm wrong, and I'd love to hear the panelists correct me, is that work seems to be more male?
Yes.
Again, if we could go to the transportation, there is actually an infrastructure slide.
Maybe Molly, if you want to start to answer, you started to answer that.
Oh, sure. No, absolutely. There is just no question that transportation and logistics and transit is absolutely essential. Everything from intercity transportation to long haul truck driving, absolutely no question. It's both frontline and in many ways, especially the intercity transit. It's frontline in the sense that those drivers are definitely in harm's way. And we've actually seen a lot of COVID cases and mortality. Long haul transportation workers absolutely are essential. And it is very much a male dominated industry. That's absolutely correct.
Yeah, actually, so just a point at this slide and the conductresses in New York City in 1918 wearing their masks. In the late 19 teens, there was a big move towards as they were often called, conductresses, women conductors on streetcars, and in fact, it was driven somewhat by World War I, driven somewhat by the feminist movement, demanding just to go back to Halifax again. It also in that instance was driven by the disasters. This is an example of what Peter was talking about disasters being a moment of occupational change and occupational mobility. And then the question, of course, was should the conductresses be paid the same amount as the male conductors for doing the same work, since as women they were imagined to be necessarily less skilled. And so this was then a major point at the point when the disaster makes this occupational change. It really shifted. It caused a lot of political and organizational fighting over how people would be trusted. That was a little bit of a tangent, but I was struck by that image of the masked conductresses.
We've been talking, and thank you, we've been talking a little bit about some things that are very clearly, I think, essential work, but I'm curious about things that, we threw in the question of a theme park worker and, a sports figure. And there's been a lot of discussion about these kinds of jobs and getting, professional sports back up and running, getting restaurants back up and running. And I'm curious what you all would think about when we talk about these topics, whether this can be seen as essential work given concerns about mental health, mental well-being.
It seems to me that the whole notion of mental health is tremendously undervalued, at least with this pandemic, that that the guidance to social distance and to isolate, to quarantine, has really run up against a wall with a population unwilling to do so, and the urge to be active, to be entertained, not to be bored, has had such power that the people that are providing entertainment have suddenly become very important, not from a day-to-day function, but from keeping society moving along. So I'm actually quite surprised on how these folks really are more essential than I think I would have originally have guessed.
Yeah, I think this is one of the places where we can look towards some past pandemics, and for me, it's thinking a lot about the AIDS crisis in the 1980s and the development of the idea of safer sex, right? That rather that there was a although there was an initial kind of thought of sex is unsafe, gay men need to have less sex. What developed eventually was the idea, well, actually, sexuality is really important. It is important to a full human life, and so one needs to reduce harm, right? So you get the rise of harm reduction, and I think that I think Peter is right that there has been less attention to this than there could be, but I think for a lot of people thinking and talking about public health, there is and there has and there needs to be more attention to to an idea of harm reduction. How do we decrease the potential harm of COVID and of COVID's transmission and disease, while also recognizing that people are, as you say, people need to have social interaction. People need to come together. So how do we do that? How do we have social interaction? How do we have, there's this picture of outdoor dining. How do we be able to go and do things in the safest possible way? So I think it's harder in the winter, but in the summer, there was, I think, a great blossoming of rethinking ideas of how can we go out to dinner? How can we go to religious ceremonies? How can we watch sports? Earlier in the summer, how can we protest and demand respect for Black lives in ways that are safer, even if they're not the most possible safe thing, which is staying at home in our apartments.
If I could just jump in for a quick moment with a backstory here. The rosary there in the upper right corner appears to be just a rosary, and certainly religion is important, but in fact, it's a complicated story of essentiality. Robert Ricks is probably not known to many people, but Robert Ricks was actually the weather forecaster who wrote the forecast for Hurricane Katrina. And here was the poor weather forecaster basically seeing a Category 5 hurricane come down on New Orleans and was absolutely convinced that the city was going to be destroyed. Weather forecasters by the Homeland Security standards are actually essential workers. But the only solace that he could take was to write a very strong report and take out his rosary and use religion to help him through a very difficult time.
I also wonder how much the time in this isn't a sprint, what we're going through with COVID-19. I think in the beginning, when we put ourselves back, it's almost exactly a year ago, March 13th is when we were declared in a pandemic. You know, in those first few months, it felt temporary. We were shutting our lives down. We were hunkering down. You know, it's been a year and it's going to continue on. This is now a marathon, not a sprint. And I think, you know, Jacob, I just identify with a lot of what you said about it's also about our well-being overall. And I think there's a lot of, when we think about essential workers, there are a lot of essential work that's now deemed unessential if you follow that guidance from the Department of Homeland Security, which matters because if you're in a place with the shutdown, that work has to shut down. That we would probably say, look, this is very important for our well-being. A lot of things that we do to cope with the mental health challenges are shut down. We can't go out, we can't see our girlfriends. I'm a mom, I've got little kids, I've dealt with a father who passed away in the middle of this pandemic and all sorts of challenges, things I might have turned to, whether it would have been an in-person therapist, for instance, or dining out with some girlfriends, or getting a massage, or going on a trip. I mean, these are sort of luxuries to have, but for some people, even small luxuries, getting out and seeing people in person, hearing music. There's a lot of experiences. Some people, yoga is their thing and going to a yoga retreat, or you know, much simpler things of just being in the presence of others, seeing family. I mean, I think a lot of these things we now think of as really essential to our well-being. The question is, in a heightened emergency, in a pandemic, does that rise to the level of being essential? Would you put that on par with getting seen in a hospital or getting an emergency dental procedure, or, buying your basics? So I think this question of what do we personally define as our coping mechanism and what's essential to us probably feels different from what the guidance is from the government about what are technically essential industries.
And I think, as you say, it's different when it's long-term or short-term, right? So I think about myself, I haven't been to a dentist in more than a year now. And is that it's not emergency, it's not essential, but eventually, I mean, in the long term, it's essential. And I would really like to be able to go to the dentist again. And so what we think of as essential is going to be different when, as you say, Molly, it's temporary, as when it becomes, if not permanent, long-term.
Molly, one of the things that I know you've looked at a lot is frontline workers and this tension between frontline and essential. And looking at this restaurant, it makes me think about food, and of course, those servers are frontline workers. But maybe the classic story would be in meat packing, where for a while meat was flying off the shelves. You could hardly buy a piece of beef or pork or chicken, and people were up in arms about needing to be able to get the meat. And almost at the same time, there were stories about how the folks working in the meat processing plants were being killed by the fact that they were so close together and working. So there was this call to not have them work and to have them work simultaneously. And it was sort of the tension between essential and frontline. How do we deal with that?
Peter, you asked such a good question. I think it's probably helpful to lay out a few different definitions, because what is essential, what is frontline, what is essential frontline? The widest funnel, in my view, is essential work. That encompasses, according to my colleagues at the Brookings Institution, Adi Tomer and Joe Kane, that's like 100 million workers fit the definition of essential workers. Because essential work runs the gamut, a lot of it is allowed to be working from home. So higher wage essential workers in management, in software development, in some administrative roles can work from home. So when we are reflecting on what does it mean to be an essential worker and what does that mean in a pandemic where work can be risky, not all essential workers are necessarily in harm's way. So often when we say essential work, we're probably in our head thinking about essential work on the front line, meaning can't be done from home and has proximity either to customers or colleagues. So we can think of easily the customer facing essential frontline roles like in a hospital or in a grocery store, but other types of essential jobs on the front line may not directly engage with the customer, but may be very risky. Meatpacking is a great example of workers working in very close proximity. I've interviewed some poultry plant workers who described you're working in such close proximity that it's almost like driving on the highway, assuming there are drunk drivers, and you just have to hope and pray no one around you had a drink. You have no control. Like if anyone around you has it, you're going to get it. So it's a very dangerous environment. And Peter, to your point, there's been a lot of controversy in the meatpacking space in particular because of decisions made in the last administration to accelerate the pace of the processing, which just makes things even more dangerous for workers. So I think it's a very fair evidence-based assessment to say this last administration, through its OSHA, through its Occupational Safety and Health Administration, did not do a lot to enforce standards to keep essential workers safe. I'll leave it at that. But so we have a lot. We get the quintessential frontline essential workers might be a grocery cashier, someone working in a hospital, meatpacking plant worker. When we looked at those numbers, we mapped that to what my colleagues Joe and Adi did. Joe and Adi found that's about 50 million workers. And when you look at those 50 million frontline essential workers, that's a population that's more disproportionately low wage and workers of color. So almost half of those workers make less than a living wage. And when we looked within that low wage frontline essential workforce, about half are non-white. So again, this burden of who's doing the work that's risky and that's low paid, it's more low paid than the general workforce who have to risk their lives, and they're disproportionately Black and brown. A separate question, though, that to your the good picture about the restaurant, there are other workers who we think of, they're out working at the front line of COVID, meaning they're getting exposed to the virus every time they go to work, but they're not necessarily essential by the government's definition. So a restaurant worker is a great example. The vast majority of fast food workers and restaurant workers do not fit within the category of the Department of Homeland Security's guidance. However, if you're a restaurant worker, either a cook behind the scenes working close to other line cooks, which is very dangerous and indoors, or you're a server serving customers, you're still at risk. You're still what we would think of as being on the front line of COVID-19, but you're not necessarily essential, which has all sorts of implications, from recognition from society to prioritization for vaccines. So there's really three categories. There's this broad category of essential. Within essential, there's frontline essential workers. So those essential workers that face risk from their jobs. And then there's this broader category of frontline workers who are not essential, who are disproportionately low wage and working in industries like hospitality, restaurants, and leisure, who still face risks from the virus, but may not get the protections that they deserve.
So we've been talking, and I think we've been talking around this bigger question that we wanted to look at, which is this question of who does the essential work. And we've been talking obviously about the things that historians always talk about, which is the race, class, and gender aspect. But I'm curious, and we've had someone ask about this element too, which is age. Someone has anyone other than AARP looked at age as a factor in this, and many working seniors gave up their jobs out of concern, since COVID-19 seemed to disproportionately impact people more the more aged they were. So has that been an element when we talk about who does essential work? Is this aging workforce or aging workers? I guess I'm thinking to some degree of Walmart too, which has often hired older workers past retirement age.
Interesting question. The mortality statistics actually do look at age as a little bit tangential, but one of the big differences between 1918 pandemic and the 2020 COVID pandemic is in fact age, that the 18 to 40-year-old group was very much at risk, and the mortalities were much higher. With COVID, that age group tends to survive somewhat better, and the older people tend to be much more at risk. In terms of low wage work, it really is it doesn't discriminate in by age, that that older Americans are often poorly paid.
I haven't seen a really good age breakdown of the essential workforce, but I am aware of some employers who have identified older workers and given them the ability to not go into work, at least for an extended amount of time, because it is a huge problem. We know that the risks from the virus are so much heightened amongst older workers. And I don't think we have an unemployment system that made it very easy for older workers to simply stay home and not be exposed to risk. So I've interviewed a lot of workers 60 plus, grandparents who've carried on working because they don't feel they have another financial choice, but that they do face that risk. There have been, I heard early in the pandemic, there were some large, for instance, in retail, in grocery, there were some policies put in place to allow some of the older workers to take extended leave. But again, this is a marathon, not a sprint. So I just think our safety net has not really provided for older workers to stay out of harm's way and still stay afloat financially.
So if we look at this, we have a question that sort of is pushing us to look in the opposite area with age, which is frontline workers who might be parents who have young children. And has there been an effort, in the past, even when we look at World War II, when so many women entered the workforce, of World War I, was there an effort in the past to provide childcare? And has that been an element now? So when we
there's been some element now that I actually don't know what has happened to these, but there have been attempts to keep schools or daycares open only for the children of essential workers. I don't, as the conversation about reopening schools has changed over the last few months, I actually don't know whether that is that has continued to be whether those kind of systems have continued in place. But I think one of the things that this is really exposing is the way that childcare is really essential to anything else in society happening. That even if you are not an essential worker, or if you're a worker who can work from home, if your children are also being educated from home, it creates drastic problems. You cannot possibly parent and teach and parent and work literally at the same moment. And I think that one of the things that this experience really has to show us is the fundamental centrality of parenting. And of course, that parenting is done overwhelmingly by women. It is women who are overwhelmingly paying the cost of withdrawing from the formal workforce. And having to what was once a second shift is now the first and second shift at the same time.
And just to build on that, though, I think the challenge, though, for essential workers who are on the front line is it can't be at the same time, because by definition they're going into the workplace. So a really heartbreaking tension that surfaced in a lot of interviews I've done with women who are frontline essential workers, particularly those earning low wages who cannot afford to pay for childcare in their home, is this idea that the children have gone to remote schooling and they cannot be there to support them. And, you know, I interviewed a woman at a poultry plant who had a 5-year-old and a high school student. I have a 5-year-old as well, all on remote schooling. And she didn't have any paid time off. She would have loved to at least be there for her daughter's beginning of remote kindergarten, and she couldn't. She felt that there was this tension between keeping a job at a time when unemployment rates for lower wage workers have been so elevated. You know, she has this dangerous job that was giving her anxiety attacks at the workplace, and yet she wanted to be able to be there for her daughter, but she couldn't. It was keep a roof over the head of my children that I love, or physically be there with them. And that came up a lot. So while I think for a lot of us who are privileged enough to work from home, we've seen how essential childcare is for us to be able to function. I think the challenges are even greater for frontline essential workers who simply don't earn enough to be able to pay for childcare and haven't been able to access. I agree with you, Jacob. I think there's been some very commendable efforts, especially by states, to open up daycares for the children of essential workers. But that doesn't necessarily always translate into remote schooling. So I think it's been a very, very large challenge.
And to me, this points to why the essentialness of teachers and other education workers, teachers, daycare workers, but then other people also, just as how in hospitals there are a lot of people who are not the prestige employees who keep the hospital running. Similarly, there are in schools people who aren't teachers but who are essential, and that those workers are essential, and kind of in the same way that bus drivers are essential, that they are the people who allow other people to work.
So to some degree, when we're talking about this issue about who does essential work, we're talking about race, gender, class. We're also talking about other sort of roles as caregivers. We're also talking about age, and you've touched on citizenship as well. And one of the things that I think has come out, and I would like us to sort of, we don't have a lot of time left, but to ask this question of how we value essential work. And this question of, several of you raised the issue that people who have caregiving responsibilities don't necessarily have the financial ability to provide the care that they need while they're working. And so I'm wondering if you see how we value essential work, is that changing? Has that changed over the 20th century?
One of the things that, if we can assume many of the people working in essential jobs are actually low-wage jobs, which statistically is at least, it depends on what you consider low wage, but well over half of essential workers are low-wage workers. There are three basic options to expect the state to create conditions where you're going to be protected, have the market self-regulate, or to form groups and be they unions or informal groups and fight for better wages. I think oddly, many people would be surprised to learn that the protection by the state is relatively weak in the United States. That a minimum wage was not even established until 1933, and that the minimum wage today is arguably not a living wage. So that government regulation is really not looking out for a lot of essential workers, the low-paid workers.
Yeah, I would just chime in to everything Peter said. I've been studying very carefully through the pandemic, how has compensation changed, if at all, for this low-wage workforce? And I've written repeatedly and extensively for the Brookings Institution about the need for hazard pay. So as a way to recognize that, again, as a society, we can't function without this risky low-wage work. In the interim, in the long run, we need to raise those wage floors permanently, and that's through a minimum wage. But right now, the hazard, I think as a society, we should be putting public money to provide increased compensation for the workers who make the least, who are at the greatest risk. That has not happened. I still think there's some chance in this next relief bill we could see some state and local aid that could be used for that purpose. We also looked at what employers have done. And I did a big report with my colleagues, Laura Statler and Julia Dew, back in November, where we analyzed 13 of the largest retail and grocery companies in the country, household names like Walmart, Amazon, CVS, Target. The headline there is that those companies have earned in the first 3 quarters of 2020 an additional $17.7 billion in profit compared to the previous year, largely because of the pandemic. And unfortunately, with only a few standout exceptions like Costco and to some extent Target, very few of them have passed that enormous windfall profit back to the workers who are risking their lives through sustained hazard pay. And so, we saw a lot of hazard pay in the early spring. Most of that ended. We've seen occasional bonuses, but the headline there is there's a picture of Walmart. Walmart could have quadrupled the hazard pay they gave its workers and still made more profit than the previous year. Amazon could have quintupled. So really, when we think about the public has shifted our attitude, support for the minimum wage has spiked, including amongst Republicans and independents. I think there's much greater awareness of how woefully too low the wages are for these workers who now we understand much more how much we rely on them. I don't see evidence that companies are voluntarily stepping up beyond a few high road examples. And we still haven't seen Congress change the minimum wage or pass hazard pay. So I see hope in the future, but my assessment at this time, almost a year in, is unfortunately those 20 million workers making low wages on the front line are seeing very little extra compensation.
Yeah, and I would just add to that the centrality of unions to this. That Peter kind of said there are these three ways we can set wages, but there doesn't get to be government regulation of wages or working conditions unless there's a labor movement that's demanding it and pushing for it. And so, right, yes, union workers can through collective bargaining and concerted action raise their wages, but they can raise everyone else's wages also by virtue of demanding a minimum wage through the government. And so I think there's one of the things that will change this problem, as Molly says, no, Walmart and Amazon aren't the owners of Walmart and Amazon aren't giving their windfall profits and aren't going to give their windfall profits back to the workers who made that money, unless they're forced to. And the way of forcing them to is through collective action, is through unionization.
Which
And it
is,
should be the protection for union organizing is often thin in the United States. Right now, there's a pretty terrific, big fight going on within Amazon over unionization, and the company is. There've been many articles about the extent that Amazon is taking to make sure that their employees don't unionize. So coming together. Organizing for low-paid workers is always very difficult. The degree of unionization in the United States is traditionally quite low, and amongst workers of color, amongst people not being paid a lot, there are a lot of obstacles to coming together.
it's a really somewhat bleak note for us to end on. But I do think that the pandemic, as you all so aptly put it, is really shown a light on a lot of these disparities. It has not necessarily given us answers to this. So I want to thank you all for joining us for a really provocative and interesting discussion. And we look forward to seeing you all from our audience next month at the end of March. Thank you again to all of our speakers, and thank you to our audience too for wonderful questions.